Thank you very much. Wow, so many people. My name is Yared. I'm a dermatologist from Ethiopia. So before I go to my project, I'll start share a story about my patient. So for the first time, I met Usmail like 2 months back in our dermatology OPD. Usmail was once a strong farmer living with his wife and 6 children in a rural area of Ethiopia. Unfortunately, he has been diagnosed with leprosy 8 years back. So once the truth about and the condition about his disease was spread to the community, the villagers started to stigmatize him, and the once nice community started to turn their back on him. And so as soon as, with every day, Usmail has been having a, it was a sad story, a pain of a stigma, and people avoided him like the plague, and like as if the air surrounding him was tainted, and some saw him as the disease himself, and as no longer he was invited to join his friends for meals and community gatherings, and even nobody tasted his food. Once the community chief even told him that he will not be buried in if he dies in their community. So with the passing of years, the disease starts to take toll on his body, leaving him disfigured and weak. And with this, his hands once have been skilled with ploughing, digging, and harvesting. He started to have the wounds of leprosy. And as the disease progressed, even his own family, his wife and his children started to distance themselves from him. They tried to push him away from his own home, leaving him hungry for days and letting him sleep in outside kitchen with no doors. And what do you feel if your family, if your own children started to push you out of your house? And talking to him, what I was feeling was a heart-aching loneliness from the community. So finally, he tried to make his own way around, traveling 200 kilometers through the difficult roads to our remote hospital. As you can see, this is the remote hospital I have been working in, with the difficult roads to pass in, and trying to get the treatment he needed, trying to get someone that can understand the psychological trauma he has been facing for many years. And the good thing about Usmail I've seen is that even with this psychological trauma, he still hopes that one day he will see a community free of stigma and discrimination against leprosy. So when I come back to our program on leprosy, it's an integrated community awareness program about leprosy and disability prevention in the rural areas of Eastern Ethiopia, which we may further expand to other areas. So with the help of my mentor, Archana, she's an amazing mentor, we are trying to achieve this project. So when it comes to the facts about leprosy, as we all know, leprosy is one of the oldest infectious diseases in the world, and it's known by its far-reached stigma and feared like more than any other disease the world has encountered. So currently there are around more than 200,000 cases in leprosy annually in the world, and my country, Ethiopia, is among the top 22 countries with high leprosy burden, and with most areas are affected by leprosy. When you see this graph shows that there is around 3,000 up to 5,000 new leprosy cases annually, which I have doubt about it. It's more than that, with steady for the past 20 years. The ugly reality comes when we see the childhood leprosy and patients with permanent disability. When we see around 11% of childhood leprosy and 12% disability, and the increment in leprosy with permanent disability is increasing so high within the past 10 years. And the other thing is the leprosy burden in childhood, which shows that indirectly shows the high burden of hidden leprosy burden of adults who are very infectious in the community. So with our project, we have tried to identify the 3 Ds in leprosy, the 3 delays of leprosy. The first one is delay in health-seeking behavior. It can be either fear of the stigma and discrimination like that of Usmail, and lack of community awareness. And the second one is poverty and public infrastructure, so it will be difficult to access healthcare service in the community. And the last one is a delay in healthcare services. It might be either training gaps in the health professionals, lack of dermatologic access in primary healthcare units, and prevention of impairment and disability in the country. So with aim of to assess the role of community awareness for the early diagnosis of leprosy and prevention of disability in leprosy patients in Eastern Ethiopia, we have 3 focus areas for our project. The main one being the integrated community outreach program. We have planned to reach around 20,000 people in 1 year for the community awareness, and followed by training of around 120 health professionals within 1 year. And we will try to renovate rehabilitation units like that of the MCR production and physiotherapy units for the disabled patients. So with our project phases, we have tried to do the planning, and we have wrote project proposal with the help of my mentor, and we also have prepared some educational tools and posters for these patients. So far, we have republished educational posters, and we have renovated the physiotherapy units from the smaller one to the bigger one and more organized project, so that the patients can have a free access for a physiotherapy unit in our hospital. And the other thing is with the opening of a new residency program in the country, I'm trying to inject the knowledge and the skill I get from GLODERM to our new 4 residents, so they can expand the program of serving underserved communities in my country. So we have some things to do. So we'll continue training healthcare workers, and we'll start the outreach program and with active case surveillances. This is our MCR production unit that has been not working for the past almost 10 years, and we are planning to restart the production of MCR production. And this is a community wound care area that has been closed for 2 decades, and we are planning to renovate this wound care area for leprosy patients that can access for free. And thank you, Amasaganalo. I would like to thank GLODERM and CeraVe for their support. Thank you.
And I love how casually he was like, oh yeah, by the way, I'm starting a residency training program. Did you guys catch that? Yeah, because I had like a separate conversation with him. So he's actually starting a new residency training program, which he's started and already has residents for like Northern Ethiopia. I just want to just take a moment because he just said that, like he like threw that in there, like, oh, by the way. Yeah, that's incredible. So congratulations. Thank you so much.